The immune disease is very common complication in the treatment of infertility by the donor acceptors. Immune disease could affect the treatment and the success rate of the patients who has some of the autoimmune diseases in her medical history, of course. There are many of the autoimmune diseases which could be on the side of the patient. Some of them could be even hidden and not explored yet. For example, we have the patients with the diabetes type 1, with thyroid dysfunctions are caused by the autoimmune infections, systemic lupus, asthma, skin diseases, and there are many others who are causing these affections. Very often, the autoimmune disease is one of the reasons of the multiglandular autoimmune disease, and this could be the trigger point actually for the premature ovarian failure. This is mostly which is actually brings the patients to the topic of the ectonation program. Yeah. So the treatment of the autoimmune diseases, it's not always easy. There must be very difficult communication between the immunologist, between the endocrinology, diabetologist, and so on. And the patients must be very, very clearly monitored during that time. Yeah, it is essential to cooperate with all the specialists. For example, the thyroid function should be in the normal ranges before we start the treatment. The diabetes type 1 should be perfectly monitored by the diabetologist. And for the treatment of the other autoimmune diseases, we mostly use the medication which are, for example, the corticoids, low molecular weight heparins, intralipid infusions, IV immunoglobulins, and so on. And all the medication has its specific indication, and also we must accept that there could be some side effects of all these medications. There is a huge variety of the antibodies which could be monitored by the blood test by the patients, and during the treatment this should be at a certain level which should be monitored by the immunologist as well. And for the example, there are some natural killer cells which could be taken from the blood, from the peripheral blood from the patient, and or which could be tested from the uterine biopsies. Yeah. So the treatment, as I told before, is not always easy. Sometimes we must say that it's almost impossible to treat the patients with the autoimmune diseases, and there is really a question of the chances how to get pregnant and what could be actually the outcomes of the treatment. Yeah, I sometimes use for my patients actually a comparison that the body is something like a computer, and there's some software and there's some malware, and the autoimmune disease is a kind of the malware. And by the computer you can use antivirus programs, but by the body you cannot delete all these diseases. And actually the whole body is living with this until the death, and sometimes you cannot remove those diseases from your body.